Join me today on episode 35 or Taking Charge of My Cancer podcast. I have an amazing physician as my guest today, Dr. Amy Comander. She is the director of breast oncology and cancer survivorship at the Mass General Cancer Center in Waltham and the Newton Wellesley Hospital, and medical director of the Mass General Cancer Center in Waltham. She's director of lifestyle medicine at the Mass General Cancer Center, which is the first cancer center to have a dedicated lifestyle medicine program. As an instructor in medicine at Harvard Medical School, she enjoys teaching medical students and residents about oncology as well as lifestyle medicine. Given her strong interest in cancer survivorship and lifestyle medicine, Dr. Comander is dedicated to improve the quality of life, well-being, and outcome of individuals with cancer through important lifestyle interventions, including exercise, diet, and mind and body interventions. She promotes healthy lifestyle for both her active treatment patients as well as those in the survivorship phase of care. She practices what she preaches, having run marathons, include 10 consecutive Boston marathons so far, with the goal to improve the life of those with a diagnosis of cancer. In collaboration with Dr. Freites, she has launched Paving the Path to Wellness. It's a 12-week lifestyle medicine-based survivorship program for women with breast cancer. Along with Dr. Freites and Dr. Michelle Tollefson, she was published the Paving the Path to Wellness workbook. Dr. Comander is currently proud to serve as the first oncologist on the boards of directors of the American College of Lifestyle Medicine. She's also on the board of the Ellie Fund, a nonprofit that provides services and support to women diagnosed with breast cancer in Massachusetts. She's a medical advisor to nonprofit organization survivingbreastcancer.org, and she has served as a medical advisor to an Oneo 40, a nonprofit organization dedicated to educate people about Ashkenazi Jewish heritage, about the 1/3 40 chance of having inherited BRCA mutations. She's married to Jason, and physician scientist to Mass Eye and Ear, and is the mom of 2 teenagers. Well, amazing. I can really kind of talk about all the great things you do all day. So welcome, Dr. Comander, and thank you for being here with us.
Thank you so much for inviting me. I'm happy to be here.
Awesome. So you want to tell us about your mission?
Ooh, let's just start with a big question, right?
Yes.
Well, I love that. Gee, well, I am a breast oncologist, as you noted, with a lot of interest. And I would say my goal, my primary goal, is to help people and make the world a better place. And in my world, that means helping my patients with cancer achieve, the best possible outcome from their disease, but also with the best possible quality of life so they can thrive along the way.
Awesome. That's great. Were you always planning to do this? How do you end up being a physician and specialize in oncology?
Well, it's funny that you should ask. I would say back in college, and even when I started medical school, I thought I would be a neuroscientist. I loved research, anything related to the brain. I worked in a psychology lab in college. I then worked in a neurobiology lab in college and in medical school, and honestly thought that was my path. And then, we change our minds along the way, right? And later in medical school, when I was doing a rotation caring for patients with cancer, I really found I developed such a strong bond with my patients. And the science was really taking off in that area of cancer biology that I just decided that my passion was really to take care of patients with cancer. And that's how I ended up doing oncology.
Well, and I am so glad for this world that you did that, because it's amazing all the things that you've been doing. So I've been kind of following you through. I kind of hear you in one of the interlude podcasts, and that was amazing podcast. So you in your bio, you're a runner. So tell us, how did you start your real running adventure?
Yes, so obviously we all need our outlet in order to stay sane with all the things we're dealing with. And for me, I can honestly say, for me, that's running. I feel so much better when I go running. So certainly, yes, I know it's good for me in terms of exercise, but it really helps manage stress, anxiety, all the things we're dealing with our job that can be very challenging, especially during the pandemic. Running was so helpful. So I truly love it. So that's why I do this marathon thing, because I actually love running. So I may as well run with a goal and run for a good cause.
That's great. 10 marathon, wow, that's a lot. I think the last thing I run was like 9 miles, and a couple of times here in Jacksonville. I used to live in Jacksonville, Florida, and they have like the 9 mile run, and it's like going through the bridges, and I thought I was gonna die. And that was it. 9 miles, that was it. That was twice,
Well,
and that was it.
Yeah.
So great. Will you give us 3 valuable tips that you learned about your journey?
Oh, wow. Well, that's a really great question. So 3 valuable tips that I've learned about my journey. So I would first of all say, it's always good to find mentors or someone that you look up to who maybe you can speak with, meet with, get advice from, perhaps do a research project with. So I think if I reflect on my college days and in medical school, and obviously since then, I've been fortunate to find someone that I would like to collaborate on a research project, someone senior to me to give good advice. So I'd say find a good mentor. That would be number 1. Someone that you might want to be when you grow up, putting that in quotes. Secondly, I think having a supportive group of friends is so important wherever you are at any stage. I think about right now, in my current job, it's challenging, right? Obviously our jobs, it's hard these days. There's lots of burnout among healthcare providers. And I feel very fortunate to have a great group of supportive colleagues who are also friends who I can reach out to for support. So finding your people or your tribe or your support network, whatever you want to call it, is so key. And then another key thing, I guess this is going to bring us back to running, is finding a hobby or an outlet that brings you joy and helps you kind of detach from the other stress in your life. Again, whether it's your job or other things going on, so for me, that's been running or other forms of exercise. So that would be my answer for you.
How about what 3 good values for the cancer patients?
For the patients themselves, you're saying? Okay, yeah, that's a great question. I'm sure you'd have some great tips on that too. I'd say a lot of it's kind of similar. I think for our patients diagnosed with cancer who are going through treatment, having that support network, that team is so important. And I often talk to my patients about that. It's okay to tell your friends and family about what you're going through. Let them support you. It actually makes them feel good to support you. So, let them have that, satisfaction from helping you when you're in a time of need. So I tell my patients the support network is so key, and I definitely encourage that. Secondly, I would encourage patients to make sure they're comfortable with their healthcare team. They should be comfortable with their oncologist, other members of the team, surgeon, maybe a radiation doctor, physical therapist. They should be comfortable with their entire team. And if they're not comfortable, if they're in a place where they can potentially look around, they should do that. So finding, a good healthcare team is obviously key, since navigating cancer is so complex. And then third, this is one I really do tell my patients: be careful with Dr. Google. Okay, we know there's so much information at our fingertips right now, whether that's just going on the internet, TikTok, Instagram, whatever, you name it. We both know there's lots of information, but there's also lots of misinformation, disinformation. So people do need to be very careful about their sources. So if you read something somewhere, look at the credentials of the person who's saying to take whatever supplement and make sure that they've actually had appropriate training to be giving you that recommendation. Be very skeptical. That would be my advice, my third piece of advice.
Yeah, that's a great advice. And, I come across a lot of the times, from the PTA standpoint, right? Sometimes we, I'm sure you spend time with the patients, but sometimes I know for physicians, it's a little bit more challenging to do that. So we tend to spend a little bit more time with them, with kind of 45 minutes or an hour with them. So as we treating them, we talk. And so we get a lot of questions about my physician recommend ABC. What are your thoughts about that? What would you do if you will be on my shoes? And sometimes we say, we have a knowledge to kind of advise similar stuff that you guys advise, but I always say, like, if you have a patient asked me the other day, I wanted to do a cleanse of my body. Like, is that gonna be any contraindications with to taking Versenio? Is gonna really make any difference? And I'm like, that's a great question that I don't have an answer for. Go back to your medical oncologist and you can ask that, because they're the ones who know about the effects of that. I think doing cleanse on your body once in a blue moon is a great idea, but you're right. I don't know if that's a good idea right now or not. So we kind of like always kind of guide the patient back to us, the physicians themselves, like, how these interact with this, instead of Google it or go by whatever family members. I think one of her family members was advising about the cleansing. That's why she was asking those questions. And it's like, it's great that you don't jump into it. Just ask your physicians about it.
Yeah, that's good advice for sure.
How about the most painful lesson that you learned in your journey?
Oh, wow. Well, I think it's always hard, this concept of failure, and I just using that word because that's probably the appropriate word. Let's say when one, and I, have two teenagers, so they're going through all the craziness of high school right now. And I'm not saying necessarily failing a test, but let's say you apply for a grant that you don't get, or you apply to a program that you really wanted to participate in, a summer program or an internship, and you don't get it and somebody else gets it or whatever. I think when I was a lot younger, I had a real hard time with this concept of failure, like maybe not getting that whatever thing I applied for or whatever. And I think now I have much more perspective, and I try to share that with my kids too, that good for you for trying to putting yourself out there, and things are not always going to work out perfectly in your favor, and try to adopt a growth mindset, learn from that experience. What could you have done better? And you'll go after it next time. And so when I was younger, I was not so good about that, but now I'm trying to be kinder to myself and help my kids handle those types of things better too, handling failure.
Okay. And how about for the actual cancer patients?
Oh, yes, for my patients. Well, I know. So that's a great question too. So you mean specifically can you just rephrase it so I make sure I fully understand?
Yes. So it's like, what will be the most, like, have you have like a most painful lesson in regards like your career with patients, sometimes, to me was like the first time I lost a patient, right?
I know, that's so
that was
hard.
the most painful. Like, oh my God, I never thought I was gonna be like, I know we are in this situation where unfortunately we're gonna have failures, or we're gonna have palliative cases. And it is just, and we always been so positive about quality of life. So who cares if you only have 6 months to live? That's what the physicians say, but that's not what, we don't know what's going to happen. But then when you actually lose that patient, that was the most painful for me.
Yeah, that is really hard. I agree with you. And we know, as a breast oncologist, like breast cancer is a bad disease. And I know it's right now, it's October, it's Breast Cancer Awareness Month, pink everywhere, but breast cancer is not pink. Like, breast cancer can be aggressive, scary, completely change someone's life, be very difficult. If it's advanced, certainly we have so many treatments at our disposal, but we can't always cure our patients. So I guess that is super hard, but I try to remind myself and my patients that there are so many amazing, brilliant researchers in this field. We are always striving to find new and better and more effective treatments with fewer side effects. And if I just reflect on the past 5 years, there have been so many incredible advances in that short period of time. So I try to really instill hope in my patients, even for my patients who do face a diagnosis of advanced cancer, because, we do have so many exciting things on the horizon, which is something I try to remind folks of.
Got you. So tell me a little bit about, how did you start this whole cancer survivorship program?
Well, I should say, first of all, cancer survivorship, this concept of, providing exceptional care for our patients who have been diagnosed with cancer from the time of diagnosis and beyond. Certainly that concept's been around for a really long time, and so important, and I know very important for the work you do as well. I guess in terms of focusing on lifestyle medicine and this program Paving the Path to Wellness, honestly, I did not know anything about this field of lifestyle medicine until probably I want to say about 10 or 11 years ago when I was working at Mass General and saw this flyer for this Harvard Medical School Institute of Lifestyle Medicine course, really focused on topics that I know we're both interested in. How do you talk to your patients about exercise? How do you talk about the role of a plant-based diet? How do you help someone improve their sleep? On and on and on. And I saw this agenda and I'm like, wow, I'm really interested in those topics personally. So
Okay.
I went to the conference and I was like really blown away because a lot of the information that was shared, I felt like, wow, I didn't really learn this in medical school or in residency or fellowship. And these are really useful tools to help my patients not only learn about the importance of these behaviors, but also how to talk to someone about making behavior changes. So learning about that and going to that conference, and that's where I met Dr. Beth Brady, who you mentioned in my intro, and she was one of the leaders at the conference, and she actually currently happens to be the president of the American College of Lifestyle Medicine, but she wasn't back then. But back then we met, and I was really interested in learning more about lifestyle medicine and how I could potentially use these tools to help patients with cancer. And that's when we kind of started a collaboration because she was launching this Paving the Path to Wellness program for stroke survivors. She's a physiatrist, and that was her area of expertise. So she was excited to collaborate with me to offer this to patients with breast cancer. So that's kind of how it started, literally going to a conference,
Wow.
talking to someone afterwards. So this is a good message for your listeners, like go to conferences,
Yep.
meet people. And I'm not some like networky kind of person. I just went up to her because I was like, this is really interesting. I'd love to learn more. Can we meet? And that's kind of how it all evolved. So I think that's a good lesson for folks as well who are trying to figure out maybe what do they want to do and what's the best way to find folks to help you out, you know?
That's great. So do you want to tell us a little bit more about the program? So it's a 12-week lifestyle wellness program.
So lifestyle medicine is really using evidence-based tools about lifestyle interventions that can help prevent and treat chronic diseases. And when it comes to cancer, certainly help optimize health, well-being, and hopefully outcome from the cancer, and hopefully prevent future chronic diseases such as cardiovascular disease, stroke, type 2 diabetes, et cetera, all the things that plague all of us in this country. And so the program is 12 weeks, and Paving, it's a mnemonic. So P for physical activity, attitude, variety, investigations, nutrition, goal setting, you get the idea. We include sleep, stress management, social connections, etc. Paving steps. Anyway, and so we dive into each topic over 12 weeks. And for breast cancer patients, we really dive deep into what is the evidence for that specific topic that makes it relevant to breast cancer. For example, physical activity. Why is exercise so important for a breast cancer survivor? What does the data show? I mean, you and I both know this, how important it is, but our patients don't necessarily know this information. So it's really important to, provide them with the tools and also help empower them to start to adopt these changes in their own life.
Okay, great. Do you expand that? Oh my God, I need to get you in here. So
everyone asks me that. I'm like, we're all a work in progress. So right now we do this at MGH and it's wonderful. And we have a bunch of women currently. I say women, by the way, men get breast cancer too. They would be welcome, but we have a bunch of individuals in our current groups. And I hope at some point in the future to be able to expand it, to offer it to individuals outside MGH, because I do think for cancer survivors, this information is so important and actually life-changing. So like, we need to get this information out there and help our patients adopt these important lifestyle changes. And they do need help. After going through cancer, you know this as a physical therapist, people are like, I used to be able to, run 5 miles. Now after chemo, I feel so deconditioned. How do I get back there? And like our patients do need help with these kinds of things to kind of get back to where they were.
Yeah, so that's kind of like, I'm thinking like, how can we start a program like that here? Like, what tools do we need to just develop something locally here? I mean, we have a great multidisciplinary team that like, that will be a great way to kind of like, how can we simulate something for what you do up there here to try to help all these patients?
I agree. Like, first of all, I love that you said you have a great multidisciplinary team. I'm the first to acknowledge I have a great team too. Teamwork is so key. So, for example, a wonderful oncology registered dietitian who works with us, physical therapist, I have a social worker, I have a psychiatry colleague, nurse practitioners, nurses, like just having a great team of people who share that passion and interest and want to help patients with, learn this information that's just the first step, finding your team. So I do love that.
Okay, that's great. Oh my God, you just give me an idea. I'm gonna start to talk to our breast cancer surgeon and say, Lisa, how can we got this? What can we do to get something? So we may pick your brain in the future.
Yeah, happy to help.
All right. Is there anything that you have that will be of a value for our audience?
Well, I will tell you, let's say you're someone listening and you're like, gee, I want to learn more about lifestyle medicine. Like, what is this field that she's talking about? So I would refer one of your listeners who's interested in that to the American College of Lifestyle Medicine website. Lots of great information there. Much of it is, free. You don't have to be a member. If you are really interested in really diving more into lifestyle medicine, like, becoming a member, perhaps going to a conference, perhaps, even I got board certified in lifestyle medicine actually in 2020. We had a little bit of time that year. So but I actually loved it. Like I loved studying all these topics about lifestyle medicine. Again, there's 6 pillars: physical activity, nutrition, sleep, stress management, social connection, and avoiding use of addictive substances such as too much alcohol, drugs, etc. So those are the 6 pillars. So I would refer folks to the ACLM website. And another resource I'm happy to tell you about, we actually, for the paving program, did start a nonprofit organization. It's on the website is pavingwellness.org. And there's lots of information about the paving program there. And some of our goals for that. And we did write a workbook, which I'm showing it to you, which I know is a little fuzzy on our Zoom, but it's called Paving the Path to Wellness Workbook, a guide to thriving with a healthy body, peaceful mind, and joyful heart, written by Dr. Beth Brady's, Dr. Michelle Tollefson, and me. And I will say the workbook's available on Amazon and on healthylearning.com. All proceeds, by the way, go to the nonprofit. So I'm not making money off this, I'm just telling you, but it is a great book to have as a resource to learn about lifestyle medicine and the paving program. So, so I do give a copy of this to all participants in our program.
That's amazing. And then I was gonna be one of my next question before the books is gonna be, so you touch on nutrition. So what will be a good tip on nutrition in these all cancer survivors?
Oh, yes. I love this question. First of all, be careful on TikTok, Instagram, whatever you're looking at for your nutrition advice, because we know there's a lot of ridiculous advice out there. So I usually refer patients, certainly the American College of Lifestyle Medicine has lots of good information about a whole food plant-based diet. But for specific information directed to cancer patients, I also love the information shared on the American Institute of Cancer Research site, AICR. Lots of great information about diet, recipes, key recommendations for both cancer risk reduction and for survivors. So very evidence-based and lots of interesting, helpful articles too. So that is a trusted site that I highly recommend.
Okay, great. Great to know. Well, as we're talking a little bit about nutrition, what are your thoughts with fasting, like intermittent fasting and white counts? That was just a patient asked me that. I'm like, I'm going to meet with Dr. Comander. I'm going to ask her if she knows.
Intermittent fasting with regard to their white count? Is that what you're saying?
Yes. So is that intermittent fasting make any difference on their white counts?
Well, if someone were doing it during their chemotherapy treatment, I can imagine, perhaps that's been looked at. To be honest, I'm not familiar with exact studies looking at the effects on the blood counts with the use of intermittent fasting. I mean, the concept of intermittent fasting in general, is, potentially useful for an individual trying to lose weight. It is a strategy. It's not the only strategy. I know some of my own patients do choose to do that. Perhaps they, eat during, just to explain it to your listeners, maybe just as an example, and there's different schedules of doing it, but maybe you, after dinner at night, you don't eat again for 16 hours. So maybe you don't eat till 12 o'clock the next day. So you have 16 hours when you're not eating and 8 hours when you allow yourself to eat. And there are studies that do show that patients perhaps have more effective weight loss with that approach, but it doesn't work for everyone. And some people need their breakfast. You know what I mean? Like, I'm a breakfast person. I need my breakfast. I run in the morning. I better have my breakfast. You know what I mean? So, and there is interesting data, certainly in the breast cancer population, provocative data that perhaps, a 12 to 13-hour fast overnight, perhaps that data suggests that there may be a reduced risk of breast cancer recurrence from individuals who follow that was noted in a retrospective study. So I think it's an interesting area, but I don't come down strongly recommending that patients do that. It's that if they're interested in it, I would support someone who wanted to try that.
Got you. Perfect.
I don't really know specifically about the white count. I'm sorry.
No, that's okay. No worries. We have one of the medical oncologists, I think was maybe from Canada. He's here, but he was looking at some research out of Canada about doing some fasting prior to chemo infusions to really decrease some of the secondary effects like, nausea, fatigue, those kind of things. So I have seen some of the patients has really good results with it.
Yeah, there's definitely been some reports, and I've had some patients choose to do that themselves as well. Some of them had a good experience, some did not. So, but it's certainly an interesting area that I do think needs further research for sure.
Okay, perfect. So how about any books besides the one that you just mentioned? Any other 2 books that you will recommend to our audience?
I'm going to share the last 3 books I've read because I knew I did know you liked this question. So one book that I actually listened to in the car over the summer, which I do recommend. Maybe I do a little bit of a different take on it. I could explain, but I don't know if you're familiar with this book called Outlive: The Science and Art of Longevity by Dr. Peter Attia. So I'm trying to show it to you on the Zoom. So it is, a lengthy book. Certainly if you're listening to it, it is as well. But he really tries to dive into the science of what steps can we take, really kind of lifestyle medicine, in terms of helping reduce our risk of chronic disease and improve longevity. So it is very evidence-based. So I really do appreciate that aspect of this book. And there's lots of practical things one could learn from this book. So as a breast oncologist, I work with women primarily. And so I would like to see more research studies specifically focused on women. So maybe that's a future project for me, but I do recommend the book. So it's called Outlive. So that's one. You want more recommendations?
Yeah. Love it.
Another book I'm reading, which I am really interested in, the concept or learning more about the field of positive psychology, learning more tips and strategies to help my patients navigate, as you know, the ups and downs of a cancer diagnosis. So actually the founder of the field of positive psychology is Dr. Martin Seligman, who's a researcher at the University of Pennsylvania. So this is just one of his books called Flourish: A Visionary New Understanding of Happiness and Well-Being. And this was published, I think, in 2007. So it's been around for a while, but I'm just reading it now. 2011. But I do really like it. So I highly recommend it. And then another book I just finished, which is actually recently came out, and I also really liked it. It's called Master of Change by Brad Stulberg. How to excel when everything is changing, including you. So again, sharing strategies for how we navigate change, the ups and downs of life, our difficult journeys. And I did really enjoy this book. And so that would be my 3rd recommendation.
That's great. How about podcast?
Oh, well, your podcast, of course. I do recommend, love it. In terms of podcasts, well, I do have to share my favorite all-time podcast. And I guess it helps that I'm friends with the podcaster. But have you heard of the Happiness Lab with Dr. Laurie Santos?
No, I haven't.
So I'll call her Dr. Santos, but I really know her as Laurie. So she is a professor of psychology at Yale. And I think it was back in 2018 when she was a professor, she noticed, like, wow, my college students, they kind of seem down and anxious and not as, just noted mental health changes in college students. So she decided, as a psychologist, to really dive into the science of well-being and happiness. And she offered a course at Yale really focused on the science of well-being. And her course, the number of students who signed up, like, broke all the records in Yale's 300 plus year history.
Wow.
Like, she had to have an auditorium to host this class, okay? So anyway, her course was a huge success, really focused on scientific strategies that have been shown to improve well-being, such as gratitude, things like that. And the students had to do exercises. That was their homework, to have like a gratitude journal, for example. Anyway, she's now taken sort of the findings from that class and the lessons and turned it into this podcast called the Happiness Lab. So if one is interested in improving well-being, and who isn't, I highly recommend her podcast.
And is the Happiness
Lab, like scientific lab, exactly. LAB. It's a great podcast.
Excellent. Great. How about movies?
Oh gosh, movies. I know. So let's see. Well, I know I don't get to like watch movies that much. I'll just tell a fun one because let's be honest, I loved Barbies when I was a kid, and I did love the Barbie movie. And, I wish I could have seen it with my childhood friend, Dory. She was my friend. We played Barbies together. But I do love the take of the Barbie movie, really kind of focused on women empowerment. And I just thought it was so much fun. Did you see the Barbie movie?
No, I haven't yet. I don't have the support because I have 2 boys and a husband who is anti-Barbie. So I don't want to go to the movies by myself. So I guess I'm waiting until it shows up on Netflix, and then I'll see.
Yeah, well, you will. I bet you'll enjoy it if you were once a Barbie fan.
Yeah. So it's like I was trying to convince them, and they're like, "No, it's not happening, Mom." I'm like, "Okay."
An interesting fun fact about Barbie. So this woman named Ruth Handler was the inventor of Barbie, I think in the late 1950s. And sadly, when she was, older, I think at age 70, she developed breast cancer herself. So she had to have bilateral mastectomies. So guess who invented the first silicone breast prosthesis?
Oh my God.
Inventor of Barbie. Clearly, she learned something along the way by making these Barbies.
Oh,
and
wow.
there were not great options for women at that time who wanted a prosthesis, who had a mastectomy. So she invented it. So that was a fun fact that I learned, recently, that now I appreciate as a breast cancer doctor who likes Barbies. So I thought that was a good thing to share with people.
Oh my goodness, that's a great story. I have no idea. Look at that. So I wonder if that's why, where you just mentioned that, I wonder because everything about Barbie is pink. So I don't know why is everything around Barbie pink. I don't know if it's anything going back to that or not. I don't know.
I know. I think it's, Barbie does like pink.
Exactly. It is one question that you wish I will have asked you and you will have answered.
Ooh, well, I would like to take the first question you asked me and put it back to you. What is your mission and passion, and what would you say to that question?
Oh, great. I love it. So, I've been a PT for like 33 years, and I did for the longest time orthopedics, sports medicine. And in the last 14 years, that's when I was, came in to do oncology. And that was just, everything just happened because I wanted to start leading a program in something. And so the manager I used to work with at that point here, he's like, well, would you like to be a manager or something? I'm like, no, not really. I wanted to kind of take on in a program. It's more like a lead team more than anything else. So like, well, we need somebody to try to lead team the oncology like program that we have. And I'm like, oh my God, I have no idea about oncology, right? Like I do ortho, I'm a very strong manual therapist, and I was doing aquatic therapy, and I was doing all those other things, but I'm like, I really don't know what I'm going to do with a cancer patient. So I was like, well, let me go and shadow my colleagues, here and see what is all this about. And I came and I shadowed for like a couple of weeks, and within the first few days, I totally fall in love with the patients. I mean, they're just the more grateful, patients, they're like, they put it all in no matter what they're going through. Like, they can be sick going to chemo and they're here for their appointments and they feel so much better every time they come. And I was like, oh my God, this is just, and then I'm able to do a lot of hands-on with them. So, because like I said before, I'm a very, very a strong manual therapist. So I was like, no, this is just right on my alley. So I was like, let's start leading this program. So I start to going to classes and start going to really a lot of like, the like people in the field that I was knowing a lot about oncology, and start learning and became a CLT, a lymphedema certified specialist, and I started to get involved with NLN, give some conference with Cheryl Brunel. That's how I get to you. And then I started just doing this. And then I was like, last year I was like, I feel like my patients have, every time they come, they just feel like, I wish I know this about this. And I'm overwhelmed. And what else can I do? And then I just start listening to some of the podcasts. And then I'm like, you know what? I think it would be a great idea to start developing a podcast for these patients where we can start just giving them education. But I didn't want to do a podcast just talking about the medicine part. I wanted to do it like I wanted for patients to see that you're Dr. Comander, but your fun facts is like you're a runner and you like Barbie, and you see what I mean? Like it's just seeing like you're a human being like everybody else, that you have your pains and you have your down days and your good days, versus just seeing you as a doctor, right? Sometimes they're just the doctor, and we don't deal with anything else but just listen to the patients, and we have other certain amount of issues with us, every day that they don't see. So I wanted to start bringing people to this podcast that was like all part of the interdisciplinary team. So all the pieces of the puzzle. So, the medical oncologists like you, the radiation oncologists, surgeons, and not just breast, but all kind of cancer, nutritionists, acupuncture, mental health, all those little pieces of the puzzle to try to really get survivors, like caregivers, all those kind of things. So patients can just learn and be educated for like a really good resources. Like you say, it's not necessarily go to Google or just listen to somebody out there who they have no idea, versus listening from the experts and listening from what you guys have to teach them, and see like, your journey as well. Like, it's not always difficult for them just because they've have cancer. So you may have a journey where you didn't have cancer, but you have a tough time for different situations in other times, right? So I kind of like wanted to get people to just not see the doctor, or the nutritionist or whatever specialty you are, but seeing what's happening behind the scenes, right? Like what other things happen. So it has been super fun. So my mission is to just continue growing it and just really give out education to patients and kind of facilitate their journey
That's
going
great.
through cancer. So yeah.
I love it. That's great. Well, good for you. And it's an honor to join you.
Oh, thank you, thank you, thank you. Well, Dr. Comander, thank you so much for doing this with me. I really, really appreciate it. You've been amazing.
Thank you so much for inviting me. It's been a lot of fun.
Okay, you have a great evening.
Thank you.
Bye.